I wanted to update you on cases. We still only have one case in Mecklenburg County. The second one that tested in Mecklenburg County was a Cabarrus County resident. So we are continuing to do some expanded testing in the county. I don't have the exact numbers for you today, but what I can tell you is that all of the tests that we have done and received results on have been negative up to this point, except for the one. So that's the good news. We're not seeing significant spread in the community at this point. We still have limited access to testing in this community. We're doing everything we can to get the supplies in and to have staff ready to be able to provide more testing, but we are targeting the testing that we're doing to those individuals that we think are most at risk. We continue to encourage the community to be very vigilant about taking care of themselves, and you've heard what we've said before: washing your hands, not touching your face, some social distancing. We're not talking about social isolation here, folks. Again, don't use that isolation term in that way. We're talking about social distancing, which just means don't necessarily spend a lot of time in large gatherings if you don't have to. You put yourself at risk when you do that. And if you're over the ages of 65 or have a chronic disease or have a compromised immune system, please, we really want those individuals to limit their involvement with large groups. So we want to continue to reinforce those messages to our community, and we're going to continue to meet with you on a regular basis so we can get the messages out. We were sent 3 tests. And what we were told is after you use those, we'll send you 3 more. So we have, again, limited access to that. We do have access to some of the media that you use to plate the specimens, and so we're using those judiciously as well. But the message from the state yesterday is that we wanted quick turnaround on testing, that we should send our test to LabCorp.
Gibbie, clarification, are you only getting 3 tests at a time from the state right now?
Yes.
How is that acceptable?
That's a good question. It is what they have available to give to us. They have 100 counties, and they're sending tests out across all of the counties at this point.
Why is that? I mean, whose fault is this? How is it that we're in the United States right now, we don't have enough supplies to test people in the midst of this pandemic?
That's not something that I can answer. We've seen mixed messages around testing, and we also know that the supply is just limited. So we're doing the best we can. We're working with Atrium, who has some capacity to test, and we're continuing to work with LabCorp, who has some capacity to test. But everybody's a bit limited at this point. Unfortunately, in this country, we're behind with our ability to test.